everyone, my name is Sarah Hornsby and I am here with Timothy King and Sarah Beach, and we are talking about the Fast and Functional program that they have just recently released and that I just had the amazing opportunity to take. And so I think today we really just wanted to have a discussion about how our two programs align and are so connected, and our philosophies and everything that we talk about is pretty aligned, and I'm excited to be working with you guys. So yeah, where do we start? What do you guys want to talk about first?
I think it's worth briefly just talking about the need. So, oral health therapists, dentists, orthodontists, we've found, I work clinically as a physical therapist and treat a lot of cervicogenic headache and TMD. Sarah works as a dental therapist, and professionals in this field are confronted with either trismus or TMJ or a facial pain a lot, whether you're a myofunctional therapist. You're just the people that that see these presentations most frequently, and yet the just a solid, even basic differential diagnosis of just knowing where to start with those kind of pains. I think all of us have seen some weird and wonderful prescriptions to patients as to what's actually going on. And a lot of the TMJ treatment out there is highly complex and really confusing. And so because I've had a lot of clinical success with it, with fairly conservative approaches, we thought, and part of that approach is myofunctional retraining. And so we thought, let's see if we can create something that helps simplify it for therapists and gives you a clearer and simpler differential diagnosis, just so you know what you can do with your hands, how you can assess effectively, and whether you need to refer. So that's kind of the why of the course we started, which we've called a functional approach to TMD.
Yeah,
I loved it.
Yeah, so my experience, Sarah, I've been practicing clinical dentistry for 25 years now. And so I'm an oral health therapist, a registered dental hygienist and dental therapist. And then about 6 years ago, I fell into myofunctional therapy, which was an absolute game changer, as you know. And it started to explain to me all those questions I had for so many years working with so many different specialties. So I'd worked in ortho and pros and every single specialty, and there were always questions that went unanswered. Why do you have to leave the fixed retainers on? You know, I remember in the old days we used to say, oh, just a few years, then we can take them off. But then, you know, you live long enough to see, oh, if you take them off, everything moves. Well, why does that move? Oh, just because it does. And myofunctional therapy answers all of those questions. So for me, it was a massive game changer moving into that space and working alongside a tongue tie surgeon. So doing all the pre and post op myofunctional therapy. And what I really noticed was, you know, frenectomies get a lot of attention, but, you know, sometimes they're the icing on the cake and sometimes they're not. There's quite often times that you can do the myofunctional therapy and get amazing results, you know, combined with body work, that the patients don't need a frenectomy. And then there's other times which are really clear-cut cases that we want to prepare the oral musculature for that frenectomy. So when I started to make these observations, I thought, well, you know, if we're working out muscles, you know, we're working these patients fairly rigorously when we introduce a program, and a lot of them come to us already in pain. How can you get someone who's already in pain to follow, you know, a fairly rigorous program? Yes, we can introduce it gently, but wouldn't it be nicer to support them through that journey? And so I'd learned, you know, sort of one release from Sandra Colson, and I thought, that's phenomenal, but there must be more to that. And so I went on this journey of looking for what that is. And, you know, Walt Fritz came to Australia. I did his course. I did a lot of other physical therapy type courses. And then I came across this guy, Timothy King, and he said, Sarah, I can teach you how to do something much quicker than all those long, slow myofascial holds. And that's how Fast and Functional came together. He started to, you know, integrate my knowledge with his knowledge. We taught each other over a course of 3 or 4 years. And then when we came up with it, I said to him, we need to share this because you know, it's one thing if you and I know this information, but it's been a really long journey for two really experienced clinicians. So wouldn't it be nice if we can package that up and just deliver it to myofunctional therapists like me, instead of having to go through that journey themselves, as well as physical therapists, as well as dentists. And of course, TMD and orofacial pain is the center of it all. You know, that's really, when you're looking at adults in particular, that's really the market that's in desperate need of this. But you can apply these techniques to children, you can apply them to infants, okay? And so it's been really exciting the past few years.
Yeah.
And can I say, Timothy and I live 2,000 kilometers away from each other. So it hasn't been easy. We don't live next door to each other. 2,000 kilometers we had to go to find each other to get this happening.
I didn't realize you guys live that far apart. That's crazy. Yeah. Well, I think the program overlaps perfectly with a myofunctional therapy program, and you guys are onto a lot of what I discovered is very effective patient care, where how can we do something that's practical, it's easy, it's quick, and it doesn't, you know, take a lot of effort and energy. And that's really with the program that I teach in my MyoMentor program. The myofunctional therapy that I recommend is fewer exercises with more focus on technique and more focus on how does the patient actually do it in real life, not just what we learn in, like, you know, the perfect world with the perfect patient. And so I feel like that is exactly kind of the approach that you guys took with the program. And in reality, most of the patients that I see with tongue tie, and that you probably see, Sarah, they also have TMD or some sort of pain, some sort of head, neck tension, myofascial, you know, restrictions beyond just the tongue tie. So how I see it fitting together is probably for the first, I don't know, you guys have that 8-week protocol. I think the therapist can do application of that treatment for the first 4 sessions, you know, and then beyond. But for me, and it, you know, my program, I might structure a little bit differently, but I think anyone with what they're already doing in their practical clinical situations can implement it. So I see patients once every 2 weeks rather than once a week. And so for me, being able to do a treatment like that, and then have it take 8 weeks for the first 4 sessions, that's typically a pre-op, pre-tongue tie protocol for me. So I think in my case, it fits in actually really well because of that time. You guys have the same amount of time that I do. So I extend things out a little bit more. And I think that actually works perfectly with dealing with a lot of the pain that can happen from a tongue tie, or just from all the soft tissue dysfunction that we see in patients with these problems. So
absolutely.
I don't know.
And of course, you know, of course, this goes hand in hand with a body worker as well. So this is just one small piece of the puzzle. The other thing I find is what it does is it really encourages those patients who don't see chiropractors, or who think osteopaths and chiropractors are all a little bit scary. It gives them that instant relief. And then you can gently hand them over. And so you're working in collaboration, because we know doing the 4 muscle protocol isn't going to fix everything. But once they go and see their body worker and have that cervical spine and all the other things attended to, you get incredible results. So you're working hand in hand. And I think it's a really great, like you said, it's a foundation. And I know in the US, and I don't know if it's similar in Australia, but a lot of us hygienists and dentists have a hard time finding the right body workers who understand what we do. So I think this kind of can lay the foundation and allow you some time to find that perfect referral partner, where maybe eventually, of course, they're probably going to need more, but at least for the patients who won't go and won't do more, you can teach them either something to do on themselves, like this is what I do when I do therapy online, or you can manually do it yourself if you're there in person. And if they find relief in that, then maybe that will encourage them to go see a provider who can do a little bit more. And, you know, I think that's where someone like, you know, all of us wish we had a Timothy King that we could just exactly. So and
I was going to say it helps with the just the knowledge and the terminology. Like as a dentist, once you've surveyed an individual's symptoms, you know whether it's more articular, you know whether it's more myofascial, you know whether it sounds like their cervical is contributing, and so you can talk to body workers with a little bit more clarity. You can say, oh, I'm seeing this person. They've got a pain pattern that really looks like a masseter pain pattern. Can you work on that? Is that something you do, for example? So, yeah, with that kind of knowledge, it can certainly help find the right person.
Yeah, and it's crazy because we learned all that anatomy, didn't we, Sarah? We learn it all, but we don't learn until you do myofunctional therapy. You learn about function, but then you want to have this extra piece of the puzzle to really tie it all in together, and especially the new science, pain science. That's the thing that's blowing my mind over the past few years. None of us were taught pain science the way we understand it now. And Timothy's great at explaining that, aren't you, Tim?
Love it.
Yeah, I like that part of the course. You guys added in a bunch, you know, you had the 4-muscle protocol, you have the videos of actually the hands-on technique, which I thought was explained super clear, easy to see, easy to understand. I was like trying it on myself, you know, going through it. And I think, you know, I've taken a lot of courses where people will explain stuff and show stuff, but this was definitely one of the more clear ones with the way you described the landmarks and how you showed the skull and everything like that. So for me, I was like, oh, this is actually really simple and really effective, and it's something that I can implement right away. And so I was like, this is perfect. This is like right up my alley. Like, this is what I need.
That's what we just want people to use it, because it really is. And we've had feedback from people that have done the training that are actually using it. And they're like, wow, this actually works. Yeah. And we're like, yeah, it's not just information. You have to do it. I was chatting to a myofunctional therapist who's really keen. Like, she was asking us well before the program was complete, when's it ready? When's it ready? And we finally completed it and gave, you know, she purchased it and got into it, and she's done the whole course. And then she asked, I've got a couple of specific patient questions. Can we have a Zoom chat? So I said, sure. So we had a chat, and she said, I've got this patient with that symptom and this patient with the other symptom. And we chatted about it. And I said, are you doing that kind of, have you checked lateral pterygoid? Like, have you done that actual technique? She's like, well, no, I haven't done that yet. And I'm like, you were so keen. Like, you have to do it. Like, it's like, just use it and see what happens. I think there's a bit of a mentality both in the medical profession and certainly the dental that we're so highly technical about this thing until we've done the cone beam scans and we've done the, you know, the ultrasound, the x-rays, and measured the distance between the condyle and the glenoid fossa, and just done everything before we do anything. So we have this crystal clear diagnosis. Anyone that's been in medicine of any description for long enough knows it's even, well, and the pain science these days is telling us that the scans only tell us half the story, and maybe not even that. Pain and the articular damage that we can see, there's a disconnect between the two. And so it's much more effective to provide a non-invasive intervention and see what changes, and let your kind of diagnosis evolve as you go, rather than try and wait until you've got it 100% figured out, you know, because that's so rare.
I like how the treatment and the diagnostic process are almost one and the same.
Yes.
You know, it makes it, I think, really simple. I mean, maybe for some people that's confusing, but I think it's actually great to be able to go through and, you know, you kind of do the assessment and you're doing a treatment at the same time. And then the patient can give you immediate feedback on, oh yeah, that feels better. Or the pain I had here is now better. And so, you know, okay, well, it was partially the masseter. And so you can go through those 4 muscles. And I love how simple it is, and it's easy.
And there's nothing lost in going through that with a non-pain patient. You know, I do this in all of my dental examinations. You know, just on my regular recall dental patients, I do this simple protocol. And, you know, if there is no pain, what you'll get is, oh, that feels really good, don't stop. What a nice way to enter a dental examination. You know, to be felt cared for, and to have those muscles assessed, There's so much power in touch and just that care, but identifying things at the same time that ordinarily the patient wouldn't have flagged to you. Oh, I didn't think my headaches were anything to do with the dentist, so I wasn't going to mention that. But yeah, I get terrible headaches and I get terrible pain here. Oh, well, we can help you. We can discuss myofunctional therapy. We can talk about body work. We can go through that protocol. And the issue I had, Sarah, was I couldn't get rid of these patients. They kept coming back to me for treatment. And I said, no, I'm not a body worker. Go to the osteopath, go to the chiro. And they said, but you fix me better. And I said, but I'm not a body worker. So this is where it's really important. Yeah, get great at what we do, but also find someone local who understands. And we've been fortunate enough to do live courses in Brisbane. So I've got body workers here in Brisbane. So when I see my dental patients, do the assessment, say, go and see Kathy, she's just up the road, she's done our protocol, tell her this is what I found. And then I hand them over. So it works really beautifully. So then you get to focus on your dentistry or your myofunctional therapy, and that patient is not just being looked after by you, but also by that physical therapist. So yeah, so it's been an exciting and really awesome journey, and to share. Yeah.
Sarah, I'm intrigued. You're a myofunctional therapist with a lot of years of experience. Was there anything in this training for yourself personally that kind of jumped out, like a bit of a aha moment, or a big kind of takeaway, or that shifted your thinking in any way around this stuff?
I think I've always been a little bit uncertain or almost afraid of like the myofascial releases, and thinking, oh gosh, this is such an area that's like I don't understand. And so I think the biggest takeaway for me, because I had heard of doing different techniques, but I thought it was going to be much more complex, and it was intimidating for me before, and now with this course, I feel like, oh, that's something I could do. That's something I could teach. And, I think it's not as intimidating as I expected it to be.
Yeah,
and
good.
So it's, I just love, and I'm lucky enough that I had the opportunity to see you guys give a little presentation in person too. I think that was like a year ago it was
a year ago, like last week or the week.
I know. So I have seen you guys do some of these techniques with patients and seen them like get huge improvements and in like a very short time. And so I kind of knew going into it, okay, I already believe in this stuff, but now I get to take the course and, to see what you're doing. And it's just, I know it's one aspect of what Timothy does, because he's doing much more, the full body stuff. This is just one small area with 4 muscles. And if that can be effective, in one area, I can't imagine working with you, as like a full body practitioner,
Yeah, absolutely. And that's how I found Tim. He already had written an online training program for the full body, and now that's available online as well. So yeah, you can apply this technique to any part of the body and get amazing results. And so so following Tim's online course for the body is phenomenal. And that's how we got together. I said, can you just
she actually saw that.
This? Yeah. I was going to do his full body course and just try to adapt it myself. And then we decided working together would be much smarter. But as you said, Sarah, once you have the confidence of a physical therapist telling you it's okay, and an experienced dental practitioner who's put this into practice, we've fine-tuned it to know what the patients can tolerate, to know how to communicate that to them, to know how to keep it within our scope, and to make it safe for the patients. That's the thing, it's safe. It's not long, slow holds that are eating into your appointment time. It's all inclusive. It's safe, it's comforting, it's part of your assessment, your listening, your therapeutic alliance, you're addressing pain. You're doing so many things in that space of time. I often do the protocol after I've given LA to do a filling. So I'll give a block injection, and then I'll go through the protocol, because guess what? My patients can keep their mouths open much more comfortably and for much longer if I'm doing some quadrant work and they've had the releases. It's incredible. Sometimes, on the rare occasion I forget, and I'm always punished for it. The next time they come back, they go, oh, can you do that thing that you did that other time? Because I felt much better after having my fillings done. So many applications for it.
Yeah, I do think it's something that any dentist, of course, any myofunctional therapist, I mean, that's like a no-brainer, but
Yeah.
I think any dentist could really benefit, and probably even hygienists who aren't doing myofunctional therapy.
Absolutely.
Like you said, that application with the anesthetic, and
Yeah.
even, you know, probably patients who, you know, when you have your mouth open for a long time, there's a lot of pain. You know, a lot of times people leave dental appointments saying like, oh, my jaw's so sore, you know, so if you could finish up an appointment with that, it could be a really great kind of thing to give to a patient.
Because you know what, Sarah, that sometimes, oh, my jaw's so sore, can be the trigger to their pain.
Mm-hmm.
So we are actually, if you've ever did any craniofacial pain conferences, it's actually quite frightening what dental practitioners are responsible for. Hey, Tim, the amount of things that I didn't know, and they're telling us this, you know, irreversible chronic complex pain was caused from a dental injection, or was caused from an extraction, or was caused from endodontic work. We are responsible for so much. So it is our responsibility to be aware if there are extra things that can support a better dental outcome. But even GPs, medical GPs, I was talking to my GP the other day, and she said, yeah, because they're the front line. And she goes, yeah, we actually don't have a clue. We just write them a script or tell them to go somewhere else. She said that would be really useful even for us to be able to differentially diagnose and to send the patients to the appropriate person instead of sending them straight to the surgeon or sending them straight to the Botox.
I'm lucky enough to have a maxillofacial surgeon in Geelong where I am who sends me patients, and almost without fail, if once I ask the patient a few questions, they might have trismus, or they might have a clicking or locking TMJ or some kind of condition like that. And I'll say, have you had any dental procedures lately? Have you had any orthodontic work? Or, yeah, it was about 3 months ago I had a crown done or something. I'm like, how long have you had this problem? Oh, about 3 months. You know, it's just, it happens a lot. I'm not blaming dentists, but we've had dentists do training with us who have been really forward thinking and just right across it. So they're like, oh, I've had my patient with their mouth open for an hour, lateral pterygoid, you know, they're starting to get some pain. I recognize that pain pattern, and they'll stop. They'll give the patient a little bit of treatment, a little bit of the right advice. And typically that's all it takes to make sure that thing doesn't turn into something more chronic and severe. Because once a patient gets pain, then they kind of stop moving and they think, oh, I might break something, and they become afraid. And so they stop moving their mouth, and then we lose all the benefits of myofunctional therapy, for example. And the pain degenerates into a persistent chronic pain cycle, and it just, and so just a little bit of the right education and some of the right techniques early on can solve all sorts of things. Now, I'm also going to say, Sarah Hornsby, we haven't had a proper introduction from you in what you do. So make sure we don't forget that before we...
I can.
Well, I was going to say this segues beautifully into what Sarah does with her Myo mentoring program, because you know, it all fits like a hand in a glove. You know, it's movement is the key, and like you said, when patients come in pain, or patients are suffering pain, they don't want to move anything, and traditional TMD treatments tell us don't move it.
Be afraid.
But it's actually, apart from those acute cases, it's actually the opposite. And that's where myofunctional therapy is golden. Motion is lotion, move it, you know, and your gentle approach. I love that. You know, I think it's so much smarter to do it slowly and gently over a space of time to get really long lasting results. And I often say to my patients, you know, you can go to Jenny Craig and do their 8-week or 12-week weight loss program, but then you'll get fat again, because, you know, you'll get these amazing results in a really short space of time, And we do see that so often in myofunctional therapy. I know when I first started out, I was like, wow, awesome results, really short space of time. And then 6 months later, you know, they hadn't done a thing. So
it's the same in the physical therapy world.
yeah.
Like there's a lot of therapies and types of adjustment that make you feel better like straight away. But I get patients who've had a lot of that type of therapy come to me and go, well, it's great at the start. I just found I needed it more and more often as time went on, whether it's neck pain or back pain or whatever. I'm like, yeah, that's the wrong way around. You should need it less often if the therapy's doing what it should be doing. It's very similar.
Yeah. So what you're doing is great, Sarah, and you'll explain it to us. But what I'm seeing a lot of is oral health therapists, dental hygienists, dental therapists, speech pathologists, all going and doing these 28-hour myofunctional therapy programs. And then I'm the one that gets the phone call from the Australian lady saying, what do I do now? And I said, well, you need a mentor. That's what you need. I'm in Brisbane, you're in Sydney. I can't mentor you from here, but there's an online mentoring program. So tell us a bit about that. So that and Tim and I are going to be joining you on your next program, which starts today. So it's really exciting. We'll be able to share even more of what you do because we'll know what you do. So
no, I'm super excited to have you guys on board. I'm so glad that you are excited to take the course and that you want to and that you want to learn more, because I know you guys are both already brilliant. You already know so much. So I'm always honored when experienced people want to take my program. But you're right. I mean, what I discovered is that there's a huge gap in the training. So people take the traditional 4-day courses, which are amazing. I mean, they're really great. They're inspiring. They're exciting. But you get home and you're back to your normal life and you're clueless. You have no idea what to do, how to implement it. And, it was really out of my own frustration with that situation because I had taken 3 of those courses, those 4-day 28-hour courses. And I just still felt like I want a mentor. I want somebody to hold my hand. I want to be able to actually do something with all this amazing information that I have learned. So I started the program about 4 years ago, and it started off really small. It was just me and like a handful of other hygienists. And I was just trying to make people actually able to practice the therapy and use the skills that they had learned. And so that's what I do now. It's a 12-week program. And so we meet twice a week, Monday and Thursday this time around. And the calls are about 1 hour and 15 minutes each. And the idea is we start with a lecture on Monday. So you learn a topic. And then the idea is you go out into, Tuesday, Wednesday, and Thursday, and you get to talk to patients, implement the knowledge, and then we talk about it in a discussion call on Thursday. So that's really the way the whole program is set up. The 12 weeks is broken into 3 modules. So the first module is purely symptom identification, nothing else. Like, how do you look at a patient physically? How do you look at their health history? What about their symptoms? How do you know that they need this treatment? So that's the first 4 weeks. Then the second module is 5 weeks, and that's the therapy. So that's the treatment protocol that I teach, the program that I teach, which is typically a 12-session program. It can vary depending on the patient's needs. And like you said, it's spread out over a longer period of time, probably 9 months total. And I want the therapists, whether they're hygienists, dentists, physical therapists, whatever, the people in the class, the students, I want them to know how to actually do the treatment, and I want them to see patients. So part of what I do is say, okay, in the beginning, I want you to make a list of 10 patients, and we're going to actually treat them when you come out of the program. And so it's really kind of holding people accountable as time goes by. The third module is practice management. So that's everything from, how much should I charge? How do I write a chart note? Things that are really obviously, it's stuff you need to know, but it's not the first thing on most people's minds of, you just want to learn the exercises, right? But then you kind of get stuck with the practical reality of what about charging and what about documents, what paperwork to have people sign. So all that is at the end of the program, and that's the final 3 weeks. So
that's brilliant, because it is something that does take a long time to learn. And I know you and I, like you said, back when we started, we didn't have that. And
No.
we were just, I don't know, it's something
Yeah.
I'll never ever forget how hard it was to be
It's so
on
hard.
my own trying to work all that stuff out. It was
Mhm.
it was really grueling, and so you know, if you're a dental hygienist in a practice and your dentist wants you to do it but doesn't support you, you
Mhm.
need to do a program like this to be
Yeah.
able to not only educate yourself but educate your dentist, educate your patients, to really go through that and give you confidence to be able
Yeah.
to start doing those assessments, start, you know, how do you have those discussions with your patients to tell them that they
Yeah.
would benefit from a program like this? How do you frame that? So yeah, so I'm really excited to see how you've structured all of that, because
Yeah.
again, it's probably like when you did our course, it's all stuff you kind of know,
Heard.
but
Yeah.
to formalize it, you know how much work it takes to put a course
Yeah.
together. So, you know, but once you've done it and then share that knowledge, it saves everybody else years
Yeah.
and years of hard work. So it's absolutely, and like you said, you did 3 of the 28-hour programs. I don't know how many of us did that. We just kept doing the 28-hour
Yeah.
programs, hoping that
Mhm.
we'd have this epiphany one day, but
And
it
you
never
don't.
happened. So save yourself the money, do 1 28-hour program, and then invest the money into a mentoring program.
Yeah.
You'll get far more value, and particularly if you provide assessment forms, and you know, if you hold their hand through that entire process, that's
Yeah.
you'll get your practice up and running in a
Yeah. I
really short
mean, in
space of time.
reality, I created the program that I wished I had when I was new.
Yes.
So that was my whole goal. And I remember thinking back, I started doing myofunctional therapy in 2010. And I remember thinking in those early days, like, this should be easier. This shouldn't be so hard. Like, people really need it. But it's just like the barrier to entry is so challenging because the path isn't so clear. And so I was like, there should be a clear path. I want to create one.
Yes.
So I did.
Yeah, no, good on you. Congratulations. That's
brilliant.
Very, very, really well needed.
Thank you.
Sure.
Well,
Yeah.
I'm super honored to have you guys on board. And so,
no, we're excited. So
I'm excited because I'm a little bit like the 28-hour program person I've done some training. I've sat under Sarush and like Kotlo and Sandra Colson's course, and I've done all these courses, and I've got all these bits and pieces of information and knowledge, and enough to really help facilitate my clinical practice by applying my functional therapy concepts. And I've seen the outcomes, but I'm not a myofunctional therapist, so to speak, as far as that's my clinical business. But I certainly use heaps of the concepts. So the detail that you mentioned, Sarah, when you say less complex but more detail, I'm pretty excited to hear some more of the why behind the how, behind the why would you choose this exercise over that exercise, that type of stuff.
So I think we'll have to do a follow-up webinar afterwards, because Tim is exactly the sort of person who he's got all the foundation knowledge. It'll be really interesting to see how it all formalizes and sits in his brain afterwards.
I'll be opening my myofunctional therapy clinic in January.
Well, you only work a couple of days clinically, so you'll have the opportunity to.
So much time. I'll just fit it around more uni subjects and clinical practice and online business and family. It'll fit.
Thank you guys so much for doing this. Do you want to talk about, I know you have a webinar coming up soon. Do you want to talk about that? Should we give people dates so that way they can attend?
Yeah, let's do that. So we know that when there's a program like this that's available, it's really hard to know what the content is. Does it apply to me? Is it going to be useful? And so, there's a web page that's got a lot of that information, all the course information and demo videos. But we offer a free webinar for people to come along for like half an hour, and we'll just unpack just a simple framework for differential diagnosis of orofacial pain. So it's very, very useful information just in and of itself, that half an hour. But obviously it gives an opportunity for the listeners to know whether they want to invest in, okay, I've seen the what, I see the differential diagnosis that you're describing in the webinar. That makes sense. Do I need the how, which would mean jump in, grab the course. And so that webinar has actually been really popular. I think we've had like 1,000 people sign up for it so far.
Right.
Yeah, great feedback, just even from the webinar itself, let alone people that have actually gone on to do the training after that. So we've got one of those coming up. What did we say? July
7th?
July 7th, 8 p.m. Eastern time. So that's 5 p.m. Pacific time in the US.
Yeah. So that'll be live. Sarah and I will be there, and we'll even field a few questions and comments and things like that afterwards. Yeah, so everyone's welcome. It's absolutely free.
Maybe I'll join too.
Yeah,
It'll be nice to have you.
And it's actually really exciting when we get people who've done our program join, and we see them on there. We had a pediatric dentist from North Carolina. She jumped on there, and we've done an in-house program for her, and she still bought the online program afterwards as well, because once you buy the program, you have permanent access as well. So you can go back and revisit it. You know, it's really packed with content. So to be able to go back and just, you know, listen to it slowly and do it bit by bit is really helpful. And Sarah, will you be adding a link on the bottom of this on how to contact you and how to do your
we can do that. I'll add that for sure. I think whatever contact details you guys give me, I can include social media, websites, all that stuff. We can link everybody to that. And then I'll give you guys my information too. So if anyone's interested in learning more about me and my program, then you guys can share that as well. So
yeah, no, that's awesome. When I first met Sarah, I said to her, it was like meeting a celebrity, because I was following her on YouTube, because there wasn't a mentoring program. And even before she became a mentor, she was essentially one of my mentors. And I used to direct patients who I didn't, who couldn't afford to do the program. I would say, go to Sarah Hornsby, and I would give them specific links so that Sarah would unpack for them what myofunctional therapy was, and, you know, how it all, you know, and, you know, quite often I'd get patients coming back going, yeah, I want to do the program. Now that Sarah Hornsby's explained it all and they had time to absorb it, then they would come and they would do the program. Or, you know, it was such, it's still.
I remember you directing me to Sarah Hornsby's website.
I was like, go listen to her.
Ago when we first met. There you go, Sarah.
Why reinvent the wheel if someone was already doing it? So, yeah.
Oh, thank you. I mean, I love hearing stories like that. Yeah. I mean, it's so amazing to me. I never would have thought that the videos I put up, basically because I was repeating so much of the same things to my patients every day, I thought I need a video on this so I can just send a link. But never in my wildest dreams did I think that other people in Australia or anywhere else in the US would start doing that with their patients as well. Yeah. So it's been amazing. So
yeah, no, it's incredible the impact that your work has had across the globe.
Thank you.
So yeah, so thank you. So
you guys too. I mean, this stuff, I really think this course that you guys are doing, I think it's going to have a big impact on the field of myofunctional therapy for sure, and probably dentistry. And I think the ripple out effect of what we're all doing is, it's game changing for our fields, right?
Yeah. And that's the thing. It's so many people have said to us, this is a game changer. And that's, you know, like my mentoring, it's a game changer. You want to be able to introduce things that are game changers, that are practical, they're useful. And like I said, it's so much time commitment and hard work to put these programs together that, you know, when you get clinicians like the three of us who are so passionate about what we do and who are so passionate to get better patient outcomes, that's the whole thing. There's way too many people out there suffering things they don't need to suffer. And I think it's really sad, but I think it's really hopeful when we can spread the word like this and help so many more people.